So, good morning, good afternoon, good evening. It's good evening in New Zealand, 4 minutes past 10 at night. My name is Deborah Bush, and I'm founding principal of the World Endometriosis Organisations, or WEO. Look, I'm welcoming all WEO members here to this webinar. And if you're outside the organisation, welcome in too. It's lovely to have you join us. This is going to be a great session, and we're all looking forward to it. I thought I would just, for those outside WEO, just perhaps give you a few facts about the organisation. We were founded in 2017 at the World Congress on Endometriosis in Vancouver as a global organisation to represent all the endometriosis and adenomyosis organisations in the world. We're currently 38 members strong. We represent every continent in the world, and we're growing quite quickly. What else? We're affiliated to WES. We collaborate to address the significant issues, and obviously 2017, but we had a big bundle of things happening during the COVID years where we sort of went into rest, and we have kick-started and geared up again over the last year, which is just lovely. We share expertise, we contribute to research, we support and do advocacy and engage in global initiatives. I'll be presenting more about WEO at the World Congress, so if you are going to be in Edinburgh, please come up and make yourself known to me. I can't wait to meet you in person if I haven't done already. And do come to the networking session. It's going to be a really interesting presentation, one we've not presented before at any World Congress, or in fact anywhere. So it will be enlightening, and I'm sure you will enjoy that. In 2 weeks, we'll all be together. So for those not going, we'll try and make sure that you've got your tweets turned on and you're looking at LinkedIn, because there will be updates for you as we go. So before introducing our guest speaker this evening, or your morning, or wherever you are, could you please make sure that your mic is now muted and your screen is off, so we can't see you. It just enables the production to be better, and a better connection and less distractions. So mics off and screens off as well. That's your camera off. Thank you. Thank you. I asked Ulrich to send me a few details about what he's doing, and I was quite overwhelmed, and I'm thinking I really have to, I'm so looking forward to meeting him in Edinburgh, because there's so much we have to talk about. But here's a little bit about background about him. Ulrich Bachkirch has worked in the Danish healthcare setting for more than 10 years, ultimately gaining his experience and expertise in digital public health, facilitating public-private partnerships to improve research and innovation across primary care. Since January 2021, he has functioned as FEMaLe's coordinator and program manager for the Department of Public Health at Aarhus University. Also, he's a part-time PhD fellow at Aarhus University. The goal with his PhD project is to understand why and when and how video consultations in general practice work under which circumstances. So he is very involved, obviously, as the project coordinator for FEMaLe, and here's a little bit about the FEMaLe project. Healthcare tools for predicting and preventing diseases, as well as personalising treatment and patient management, offer great clinical benefits and cost reduction. The EU-funded Finding Endometriosis Using Machine Learning, or FEMaLe project, is working on machine learning multi-omics platforms that can analyse omics data sets and feed the information into personalised predictive models. The main focus of the project is to improve intervention for individuals with endometriosis. A combination of tools such as mobile application Lucy app and augmented reality surgery software will be co-developed, facilitating improved disease management and the delivery of precision medicine. Sounds wonderful, doesn't it? The talk will give an updated overview of the FEMaLe project, present preliminary results, and after its first 2 years, and it will end with a call to action. Ulrich, the stage is yours. We can't wait to hear what you have to say, and we're listening with great interest. For those of you with questions, our chat box seems to have been in a state of rest. So that option isn't open to us tonight at this meeting. So could you please raise your hand after Ulrich's talk in the reactions box, and your question will be heard and answered by Ulrich himself. Right, so mic's off, camera's off, and Ulrich, the stage is yours.
Thank you so much, Deborah and WEO, for this kind invitation. And FEMaLe project is definitely a great endeavor, and today I'll present in a few slides a rough outline of the project, a tour de force. And we are also going to be present in Edinburgh in a few weeks' time, and we have actually 14 accepted sessions there, so I hope we have plenty of time to engage much more. So I'll just share my slides here. I presented some slides for you. So now it's in full presentation mode and I can't see you, but yeah, should you have any questions, we'll take them afterwards. So the FEMaLe project is an European Union funded project, and it's within this call, this specific call about personalized early risk prediction, prevention and intervention based on AI and big data technologies. And this is, of course, very important in the general setting of the FEMaLe project, as this points towards innovation. And that is overall the ambition with this Horizon Europe program, to stimulate closer collaboration between universities and industry. So that's also why in the very title, the acronym, the FEMaLe acronym, and behind that, the Finding Endometriosis Using Machine Learning project, that we have a strong emphasis on innovation, on developing new products and tools. So first, I have a three-part presentation here. First, I'll introduce the project itself in the first part. In the second part, I'll go through our preliminary results. And in the third part, I invite you to take part in the next movement. Sounds good? So the FEMaLe project is about personalizing early risk prediction of endometriosis with an aim to ensure a more individualized intervention and to build knowledge for prevention by the identification of subtypes of endometriosis. So already here we have, as you mentioned, as you might recall with this specific call, a strong focus on prediction and prevention and intervention. So this is what we try to achieve with the project. And my way into this was totally coincidental. Before 2019, I have never heard about endometriosis, really. So it was really interesting for me, first of all, to explore what it was. And I was really intrigued and read something about an article in a monthly bulletin for general practitioners in Denmark, this huge diagnostic delay and how big of a problem that is. So I was really intrigued, and at the same time, I read some white papers about machine learning, and could machine learning actually propose a new way forward for identification of, let's say, in this case, it was actually rare diseases. So not the case for endometriosis as such, but I sensed there could be some interesting overlaps. So the idea with applying machine learning in this way was to identify patients with a disease in a wider population based on their medical history, and then based on those data, those digital footprints, to develop an algorithm to identify these unique patterns, and then ultimately to find and target such patients. So that was the initial idea here. Again, endometriosis not being rare as such, it's very prevalent, but widely underfunded, under-researched, under-diagnosed, as you all know. So that was the first concept that just came to my mind. And the second one is this graph here, kindly borrowed from our partner Precision Life. Can we move from population to precision medicine? And this is where the early risk prediction and the whole prevention comes into the picture. So the idea again being, can we explore a whole population using high resolution multi-omic analysis? So we combine various data, and then we try to identify in a stratified way, we try to group patients. Can we then target individuals better? Because right now it's one size fits all approach, and that means that many doesn't get the personalized treatment that could be offered. And in the case of endometriosis, of course, we don't have many options, but at least this more personalized approach could actually be interesting to explore. So that was the whole idea with this FEMaLe project, to utilize some of the principles from machine learning and algorithms together with the precision medicine approach, and then to apply this into the area of endometriosis. The ambition with the project is to develop a platform that converts these multidimensional population data sets into a personalized predictive model to improve the continuum of care for those with endometriosis. And this is kindly developed by Lone Hummelshøj, a very nice framework where we try to visualize how the concept of FEMaLe covers the whole pathway for the patient, especially going from symptoms, help-seeking behavior, should or should I not seek medical attention. And this is where we try to apply the Lucy application to guide patients if they should consult their GP or not. And then when they're being referred, can we then help clinicians better to stratify patients? Can we, based on a biomarker, put patients in a low or high risk group so that we only investigate those who actually require attention? And then down that road, can we then subgroup these patients based on their conditions? And this is where we are applying some machine learning to develop these tools, and then coming down through this pathway to the treatment and the surgeons and others there. We also try to explore who is responsive to which treatments, and this is where we have this vision tool for surgeons, and we also develop a mindfulness and acceptance-based digitalization of a digital intervention, and I'll go in depth with that in a second. So the idea with this being that we have this platform, this model established in the project, so that we can combine these various data sets and ultimately, make a more tailored approach to this. And by doing so, we hope to enable more shared decision-making. This is especially the case in general practice and primary care, but of course also in secondary care, so that we personalize the whole pathway more. A part of that equation being awareness raising. That's also why I'm here today. Can we increase health literacy in those with endometriosis? Can we actually contribute so that patients feel more empowered, and ultimately improve the quality of life in those with endometriosis? So the FEMaLe project is an EU-funded project. We got granted close to 6 million euros, and the project started off 1st of January in 2021. So we were still in the pandemic period. We actually conducted the project for 15 months before being able to meet in person in Aarhus. So it was a first for many of us to do it this way, but we have managed to also make great use of these digital opportunities. Today's webinar, a great example of that, I think. And what happened when we met virtually was that we asked all participants to basically come up with one word describing what it would take for us as a consortium in order to be successful. And those two major words that came up were that we need to have a collaborative approach to this, since we are so interdisciplinary, and we needed to stay motivated, to have a lot of enthusiasm. And I'm just proud to say we had an executive board meeting just the other day that this is definitely still the case, even more than halfway through the project. We are 17 partners from 9 European countries, covering Scandinavia, Northwestern Europe, Southeastern Europe, Central Europe. So it's a great geographical distribution, and our partners covers universities, hospitals, companies, patient associations, civil society organizations, many various actors here, and it's a very wonderful team. So the project itself consists of 10 work packages. We have the core in the project, the research and innovation work packages from 3 to 8. So in work package 3, phenotype, this is where we do epidemiological studies, and we try to explore the actual prevalence of endometriosis and also update knowledge about social consequences, psychological consequences. And we look into registers in Denmark and in Scotland to do so. And right now we are also surveying, questioning 60,000 Danish women about symptoms, not only for endometriosis, but women's health in general, in order to hopefully learn more about relevant symptoms. And prior to this, we have conducted a consensus study on symptoms, and this will also be presented in Edinburgh. In work package 4, the omics work package, this is where we try to explore, are there any subtypes of endometriosis? And Krina Sunderman and team in Oxford have tried to explore this using the UK Biobank material. And then we try to replicate those findings in a Danish data set. And it's also really interesting. We have a company on board from the UK called Precision Life, and the idea with this being that we can use machine learning algorithms again to run these really high order analysis, because it's big data looking into genetics. And we will also present more about this in Edinburgh. In work package 5, this is where we develop the Lucy app, again trying to identify any relevant environmental factors, have users to share with us information about. We have in this project, it was an existing solution. So in this project, we are adding to the app by setting up a questionnaire so that we can collect data using the app for research purposes. And we have also added 2 other modules, one about dietary and another one about physical exercise. So we are really trying to learn more about the users in the app this way. And the intention with this is to produce specific patient profiles by using this app. So we also hope that can be relevant in the clinical context. In work package 6 and 7, closely linked, this is where we try to explore whether we can, based on an algorithm that has been trained using images from surgeries that has been annotated by surgeons, can we then train an algorithm to ideally automatically detect endometriosis and classify the lesions. So that's what we're aiming to produce in work package 6. And the idea with that being that then the surgeon in work package 7 can be visually guided by a computer vision tool during operation. And that should, of course, let's say, compensate, especially if you're not an expert surgeon, not so many of those, then this tool could really assist the skilled but maybe not senior expert surgeons this way. So very interesting approach. In Work Package 8, this is where we try to digitalize this MyEndo program, and it's also going really well. And ideally, we'll link that program with the Lucy app down the road so that users have access to this. And I'll just come back to why this is important in a second. So these are the 5 or 6 core pillars in the project. And then around this, since it's such a large project, we also need to run things effectively. So we have work package dedicated to project management. Work package 10, this is what I'm doing. We have another one looking into communication, dissemination, exploitation of these results and innovations. This is work package 9. And in accordance with the European Union's visions of a open society, diversity, we have chosen in this project to emphasize ethics and open science. So this is what we're working on in Work Package 2. And now actually we are producing 3 parallel white papers to discuss and make a state-of-the-art description of these topics of ethics, gender, equity, inclusion, and open science. And then in addition to the project management, we have also emphasized that we wanted to monitor and assess the impact we create with this project. Bear in mind, it's an innovation-driven project here, and there are high hopes from the Commission that we really can produce some great innovations. So we have set up a dedicated system to track and monitor the progress and the impact we create. So this is also very exciting. So this was just boiling down the FEMaLe project in work packages. And a little bit more about the innovation outputs. So in work package 4 about genetics, we also want to prototype 2 clinical decision support tools. One for risk stratification, as I described, and another one about a multi-marker signature for endometriosis. And this is the first step towards identifying new drug targets. In Work Package 5, we have the Lucy app, as I mentioned, and we have already delivered 2 prototypes, 2 new modules. And down the road, we intend to convert these big data collected through the app through some of the technical universities we have on board, and then produce this risk profile that we can then use in a clinical context. In Work Package 6, we are producing this software based on a machine learning algorithm for the detection and scoring of endometriosis. And then in Work Package 7, this is going to guide surgeons suggesting the endometriotic resection zone, the division plane. And in Work Package 8, we are developing the MyEndo program and ultimately feeding that back into the Lucy app. So just a little bit about this real-time augmented reality tool. This in the bottom here, the normal public view. This is how it's normally visualized, but with the SurgeR augmented reality tool, you can see that it's a 3-dimensional model based on the images scannings, and that will then be translated into the screen on the surgeries, and it's very innovative, I think. So a little bit about scientific impact. This was the first section of my talk. So now moving to the second one. So far in the project, we have had 21 abstracts approved and accepted for conference participation across all the work packages. So what is really great about this project is that we're not only producing scientific knowledge and publishing about these 5 core pillars, like I mentioned in the project, or the work package 3 to 8, we have actually also been able to research in the way we use something like the half-double methodology. That's a project management methodology. I'll come back to that. But we have, for example, also documented how we have been using that. And this is also where we can participate in project management conferences and share knowledge about that, in addition to how we have used social media very strategically in this project and could that actually create an impact for patients? And I'll come back to that in the third part, and this is where you come into the picture. But we have so far in the project published 4, and it's actually 5 scientific articles, and a more publicly available article in the Conversation Canada last year. So very, very promising results already, and there will be much more peer-reviewed articles coming out soon. We did an exercise the other day at the executive board meeting, and I was quite overwhelmed by the output. So we're looking forward to come back to that a bit later. But I think just to highlight a few here, this article coming out last year found that we have experienced an overall increase in the incidence of hospital-diagnosed endometriosis in Denmark, with significant regional differences. And there are many explanations for this geographical difference. You can see it on the map here below, and that there are some difference here in the incidence rate across the Danish country. But what's striking is that this suggests that quite a significant number of women may be left behind without diagnosis in some regions of Denmark. And this is, of course, a huge problem. There's a strong emphasis on equity in health these years, and it's just very important that we also show that this is the same picture, maybe even worse for a condition like endometriosis. We have also recently published a paper about the genetic basis of endometriosis and comorbidity with other pain and inflammatory conditions. And this is a study including DNA from more than 60,000 women with endometriosis. And it really reveals compelling evidence of a shared genetic basis for endometriosis and other seemingly unrelated causes of pain. So very, very fundamental knowledge to establish. This was, of course, some work already ongoing before the FEMaLe project, but the main contributors, Nilofer and Krina, have, of course, been working on this as part of the FEMaLe project. So we were very happy to have such an important milestone out. Recently, we also published this this is basically, let's say, the rationale behind the MyEndo program. And it revealed that compared to waiting list, psychological intervention did not significantly reduce pain, but it showed that women with endometriosis might have significant and large effects of psychological intervention on quality of life. So this is, of course, very, very important, so that we always remember the mental health dimension of living with a condition like endometriosis. And this is the rationale behind that we, with the MyEndo program, try to digitalize this psychological intervention. And we are exploring to which degree we can actually leave out the therapist. Could it work as a self-guided solution? So it's a 10-module psychoeducation combined with yoga exercises, mindfulness exercises program. And it seems really promising. So we are rolling out a randomized control trial here to prove if it's effective. And just a fourth example here is the translation of the endometriosis patient questionnaire. So we have a paper and an electronic version. They are equal and comparable to the original English instrument. But as is also recommended here, the questionnaire should be thoroughly evaluated by several translators, experts in endometriosis, and those with lived experience. And it just clearly shows this whole concept about responsible research, that we should be really careful to include the right stakeholders, not only in the testing phase of research, but from the very onset, so that we are positive that we are also asking the right questions, and that we are basically solving the right problems. So I think this is just a great example of that. A little bit about the project's results. So in November last year, the Commission accepted our first 18-month report So that was a huge relief. It's a lot of work. We submitted 100 pages report about the progress in the project so far, and we have had no significant objections. We didn't have to rewrite deliverables in forms of reports and all that. So that was fantastic news. Now, in work package 1, the impact work package, this is where we try to support impact monitoring and assessment throughout the project. So we have applied this so-called half-double methodology where we develop impact cases. So instead of focusing on impact after the 4 years in the project only, we try to break this down. In the initial phase of the project here, we had an idea of breaking it down into 6-month sprints. So each 6 months, we actually set specific targets, identified performance indicators. So we were always sprinting towards reaching these targets. And that has been really fun applying to such a project here where we have so many interdisciplinary researchers, companies, industry partners on board. For some, this was completely new language, new ways of working. And for others, it was just what they have done in many years. So very, very interesting learning about this. And we have managed to collect our learnings from this. And we have had a conference paper accepted for the upcoming European Management Associations conference in Dublin here this June, where my colleague will present the findings. So that's really good. Also, we have provided a comprehensive framework to secure that we are aligned with the Union's idea of an inclusive, innovative, and reflective society. And as I mentioned, we are producing 3 white papers already, but we have already participated in workshops and conferences to promote the whole concept of citizen science. And yeah, this is something that has actually become a mandatory part in the follow-up funding scheme from the European Union, the new Horizon Europe program, that you should always have users, patients involved in your research and innovation. So I think we are just happy to be a bit progressive here. In terms of work package 3, we have developed this baseline questionnaire, reach consensus on the most relevant symptoms, and published the first article, like I mentioned before, the register-based study on the prevalence, incidence, and geographical distribution of hospital-diagnosed endometriosis in Denmark. And it was just amazing to see. I remember still after August last year, we had to postpone the promotion after summertime because there was election in Denmark, and this guy, you know, did great in Tour de France and all that. So we needed to get a bit past that. But I just remember how I awoke that Sunday, and that article mentioning this specific study was all of a sudden the most read piece on the largest Danish news website. So there we really broke through the media wall. So fantastic that science can be picked up this way in the public. In work package 4, about genomics and genetics, we have set up a pipeline so we can discover high-risk genotype combinations. And as I mentioned, we're now replicating these combinations and computation of risk scores for endometriosis. And there are some really promising results, and the team will present much more about this in Edinburgh. We have created the Lucy app, as I mentioned, to monitor self-reported endometriosis, mental health, physical activity, environmental factors, to classify any behavioral patterns, underlying manifestations clinically in people with endometriosis, and develop this Lucy questionnaire involving already validated questionnaires. So we really hope to be able to publish some sound knowledge about this. Of course, it's tricky to have users engaging with a mobile health app. And luckily, we have been able to collaborate with a PhD student at Aarhus University, where we are now running an experiment, like what can we do to improve engagement with this app. So that's very exciting, actually. We have also reached consensus and confirmed this annotation pipeline by using the Delphi method. And the surgeons selected the bounding boxes method So this is the first step to develop a computer vision tool that can automatically detect and confirm the diagnosis of endometriosis and assess the different lesions. So just to visualize this a little bit, we have the detection idea here to the left, the bounding box method. And to the right, this is where the surgeon will be guided because this vision tool will suggest the division plane. And this is how it's being applied in the clinical context. We have established a GDPR-compliant legal agreement with expert endometriosis clinics worldwide. Happy to be in this very global international setting, and like as with the work package 7, we decided early on in the project that we are not only going to collect data in a few European countries. It'll be a bad decision in many ways, but it will also reduce the validity of this tool. So we actually decided quite early on to make it a little bit more international. And it's just really interesting that we have managed to agree on the legal terms here to collect data across European countries and to Brazil. And this is also just an invitation. If you could think of any ways that we could approach more clinics worldwide, then we have set up the system needed here to record and collect video data, to, in a safe, private way, transfer the data, and then make the FEMaLe team able to annotate these recordings and to train the algorithm using this information. So it's very, very interesting. In work package 8, as I mentioned, we have developed MyEndo, the online mindfulness and acceptance-based program. And we have also conducted a feasibility test, pilot test of the first 4 modules. It's currently under review. And those insights, those comments have already guided refinements and improvements in the program. So we are just on the verge to be able to run a follow-up testing of all the 10 modules. For the first 18 months in the project, we have already achieved quite impressive results. We have engaged a lot using communication campaigns, these public publications, like I mentioned before in the conversation. We have been active on social media. We have participated in public events and communicated using our website. And these numbers about followers on LinkedIn, Twitter, and Instagram are, of course, a bit outdated still. They referred to the first 18 months. So we just keep on improving our performance there. And it's just so fantastic to experience your and the community's engagement with this project, because most European funded projects will not have more than a few hundred followers after 3 years. And we can just say that this is definitely not the case with this project and about the field of endometriosis. So yeah, please just continue interacting with us. In the work package 10, we have utilized this half-double methodology to reduce time to impact, keep the project in motion, and promote leadership of people. So we have a very, agile, very people-oriented approach to the project. So we constantly try to solve problems down the road, and we try to not accept that we just stop and then when we meet a few months later, nothing has happened. So we always try to come up with some great solutions together. And this has been a fantastic experience, coordinating this project across 17 partners. And with the advisors involved, we are more than 50 people in total. Also, we have set up the Correlate platform. It's a company from Norway delivering this software as a service solution. So this is where we try to correlate using various software, various databases, various platforms to communicate effectively and collaborate. And when we are going to discuss third part in this project, I assume we'll use the Correlate platform to make this collaboration really smooth and easy for everyone to join. So yeah, that was just going through the major results. As I mentioned, with the work package 9, we are exploring ways to communicate and disseminate about the project, but of course, it's also expected of us to make an exploitation of results. And I'm just so happy to share this example with you. So just recently, a group of researchers led by Associate Professor Felicity Davies from Australia, affiliated amongst other places with Aarhus University, they got granted this project from the Novo Nordisk Foundation. And it's dedicated to a science communication project where in Aarhus we have a gender museum, and we have been allowed to experiment, but still, evidence-based, co-create a museum exhibition where in the coming years we will set up installations and a museum exhibition about women's biology and health across these interdisciplinary researchers. And FEMaLe project and endometriosis will definitely have the opportunity to guide the content for that. So it'll be a three-part exhibition in 3 floors. So we'll have gynecological diseases and of course in a wider context, not as well diseases related to women's health in the basement, let's say. And then we have in the middle floor, motherhood, parenting, breast cancer, these kind of activities. And then on the top floor, we'll discuss mental health and diseases with a huge gap in between men and women here. So yeah, it's a very, very interesting approach to communicating about this. And the main driver for this project was that even in Denmark, we have this gender museum. It lacks a lot of emphasis in the education programs. Still, it lacks an awareness of women's biology and health. So this way we intend to educate the next generation. This gender museum has a particular established connection to young people. So we really hope to make a difference with this project. Also, we have been quite successful in using the FEMaLe project as a platform to get in contact with policymakers. And on the 2nd of March, just in the Awareness Month, I was able to get into the Danish Parliament to present the case together with patient and journalist Louise Dreisig to my left. We presented the case for 29 members of the Danish Health Committee. And it was a great experience. We had 15 minutes in total. And what we gained from that meeting was that they have settled now a closed hearing process. So this is the first step towards us arguing that what we need in Denmark is a national center for endometriosis, including, of course, research and innovation and education and outreach activities. And the closed hearing hopefully leads to an open hearing in the Danish Parliament, where we can convince the politicians to acknowledge this problem and actually allocate funding for this movement, because this is what they are in the capacity to do. And we were quite happy to experience that just a month after this meeting with the Danish politicians, we actually had the opportunity to participate on national television. And this has also made a huge difference. We can really see in the activities on social media in particular that there's a huge difference just before and after these few past months. We are very active on social media to very strategically promote about the project. And just an example is this co-created social media campaign up to the right. This is an example of last year's campaign, where we had the Danish brave, proud women to stand forward here to raise some questions, to increase awareness, and to get, the community in dialogue, but especially also those in power. And what I think was interesting with this collaboration, which was really great, we translated that into English and promoted it on the FEMaLe platforms, is that we also managed to translate that co-creation campaign into science. So this is an article under review where we tried to measure the impact of a co-created endometriosis social media health campaign by using semi-structured interviews with participants from the conference, from the campaign, together with social media metrics data about reach and engagement. So yeah, it's still under review, so I can't reveal much more now, but there's definitely an interest in this topic, and I think it's a great example of what we can achieve together. And this brings me to the third and final part of this presentation, where we encourage you to, if you want, take part in this larger movement, because the FEMaLe project has identified 3 core pillars. I have already talked a lot about the research aspect and the innovation in the project, but of course, a vital pillar is awareness. And the new exhibition in the Gender Museum is a great example of what we can do to raise awareness in some years to come. But we really do believe we can make a huge difference already today. And this social media co-created campaign could offer, I think, a great opportunity to do so. There's a momentum these years about, and these months about, raising awareness for endometriosis. And like with the Danish case, where we use this social media activity to get in contact with policymakers, to get into the parliament, to present our case, to be invited into expert hearings, maybe that will lead to the establishment of a national framework for endometriosis, a national action plan, and maybe some dedicated funding to this. So why couldn't this happen in other countries as well? And we really appreciate and do know and acknowledge that some of you are far ahead in this, and you're very established players, but maybe there could be some members of the World Endometriosis Organization that could see an advantage in taking part in this movement. So we just invite you to have that discussion and to indicate whether you could see yourself take part in this movement, because then we could collaborate and we can share our resources and templates and expertise. We have Peter on board today here from the FEMaLe project, and he will be the guy you can collaborate about this with. And we strongly invite you to join this movement. So I think that was actually about it from me today. You can find much more about the FEMaLe project on the website. You can follow us on LinkedIn, Twitter, Instagram. I'll share this presentation for sure, and feel free to reach out and keep on sharing and interacting with the posts. Thank you.
One moment, sorry about that delay. Ulrich, that was absolutely fantastic. I am motivated, enthused, inspired. I really am to know more about. Obviously, I've been hearing about the FEMaLe project, but to have it explained so and articulated so well for the participants here at this webinar is absolutely enlightening. And I'm sure many others are enthused just as I am. So I'd just like to call on anybody who may have a question to raise their hand, and you may need to come back on so that we can see your hands. Or I'm wondering whether at home base in the UK you can see anyone's hand raised.
Not at the moment, no.
Okay, I think probably like me, a little bit dumbfounded, a lot to absorb, and also just a lot to process, I guess. I think one of the things that I'd like to ask, and maybe it's an administrational thing, but I didn't quite get it from the slide quite early on in your presentation. It had the pillars, Ulrich. It took me a little bit of time to actually process what those pillars actually were and where they were for someone absolutely new looking in. But also you talked about partners, and you know, I particularly like to discuss this with the Centres of Excellence here in New Zealand, to look at how we might collaborate, or so what does partnership look like as opposed to being part of the project outside of Europe? Because I know that's where your funding base is. So is that something that you could talk to us about now, or something you'd like to perhaps pop in a response that we could share with our members?
Right, good question. Thank you. So there are, of course, a lot of formalities in these projects, and also this is what I can share with you today. So there is a very rigid process of, being let's say a funded partner in the project, and this is a lot of, work. If we want to change the tiniest thing, it's very, very well described in, I think, like a 200-300 page agreement. So that's one side of things, but we still have the opportunity with this kind of project to invite others. Either you can join in such a project here as a so-called associated partner. It comes without funding, but you can be acknowledged this way, or you can be invited into the role of advisor in the project, and thereby you get access to the things I can't disclose you today. So I think that's some of the opportunities we have. These are more like the formalized ways of partnering up, but we are expected to exploit our results, and we can always make up informal, let's say, partnerships with actors that can multiply our results and findings. And this is a global invitation. Like I mentioned before, we collect video materials from Brazil. It wasn't part of the original proposal, but it's very welcomed. So we don't have any boundaries that way.
Right. So we all know the value of big data, and that's really also what I was just wondering about. So I've got lots of cogs turning at the moment and spinning in my head about some ideas that we might like to work with. But in terms of the social media campaigns, I'm absolutely sure that many WEO members and all the various continents, the continents of the world, would actually really like to know that they were involved in a whole global project such as this. So that's something that we can talk about in-house. But I really do thank you so much. And if there are no further questions from anybody, I'll tell you what, Ulrich, just as a sort of spur of the moment thought, we'll call for questions from the participants, and maybe we can flick those through to you. Would that be something you would be prepared to answer?
Yes, definitely. And again, it's our intention with this project to make, we have the opportunity now to make it the right way. Like, we're not in this for the quick fix or the quick gains. Let's spend the time now. We have momentum to do the proper thing. And it is, messy and it's complicated working with so many actors, but it's totally worth it. So yes, you're always welcome to contact us, reach out. We'll discuss things. We'll take time to reply to all of you properly. And we just hope that this could inspire some of you to join this movement. Just, the tiniest of mobilized energy here collectively, we believe could really make a huge difference.
I have no doubt about that, Ulrich. I can see it, and there's fragments of this happening all over the world, but to see something so unified, and of course using the data and digital platform is just, it makes this wonderful multidisciplinary approach so valuable. So yeah, congratulations. And to you and your team. And I know that I heard Lorna Hammelshøi's name mentioned, and it was nice to hear that as well. So congratulations.
Yes, Lorna is a very, very valued and treasured integrated member of this whole project and initiative. So we are so lucky to have these great competent, both let's say established experts in the field, but also these newcomers on board. So yeah, that's what we're trying to balance here, you know, to really have those that can put us in contact with high-level decision makers, and someone like yourself that could put us in contact with the new member organizations popping up everywhere. So yeah, let's make
that's wonderful. Thank you, everybody. Thank you to Ulrich again, to those partners, to everyone who's contributed to the FEMaLe project, and thanks to our WEO members and others outside WEO who have joined us for this absolutely wonderful webinar. We appreciate your attendance, and we will be in touch. So thank you all very much.